Ms. Ramirez. My name is Santina. I'm the student nurse anesthetist that's going to be working on your case today.
Okay.
Can you verify your name and date of birth for me?
Yes, my name is Jessica Ramirez, and my date of birth is 11/3/1998.
Okay, and what brings you in today?
Well, I was playing volleyball about 2 days ago, and then I ruptured my Achilles tendon.
Oh man, I'm sorry about that. Can you verify the procedure that you're having?
Yeah, so I'm having an open repair of my right Achilles.
Okay, and then do you know the surgeon's name by chance?
I do know that it's with the surgery team, Mr. Foot, I would say.
Okay, and then have you had any past surgery with anesthesia before?
Yeah, so I had a C-section about 2 years ago, and with that, I had a really bad headache because I got spinal anesthesia.
Okay, just the spinal anesthesia? Okay.
Yes.
And then do you know if anybody in your family has ever had any complications to anesthesia, like a high fever or an extended stay in the ICU?
No.
No? And then can you verify your allergies? Do you have any allergies to medications or latex?
I do not have any allergies.
Okay, and when was the last time you had anything to eat or drink?
So the last time I had dinner was 14 hours ago.
Okay.
And then I had a few sips in the morning with my vitamins.
Okay, and then your medical history, I see you have asthma. Is there any other medical history I should know about?
Well, I don't know if this counts, but when I was pregnant, I had gestational diabetes.
Okay, your previous pregnancy.
Yes.
Yeah.
Yes,
Okay.
my previous pregnancy 2 years ago.
Okay, and then with that asthma, do you take any medications?
Yes, so I have myobuterol, which I take maybe 2 times a week, but the last time I took it was 3 weeks ago.
Okay, awesome. And then are you taking any other medications right now?
Yes, so I take my prenatal vitamins, and I've been taking just an over-the-counter Tylenol because of my Achilles tendon.
Okay, and then you said that prenatal vitamin was this morning. When
Yes.
was the last time you took that Tylenol?
The last time, I would say the last time that I took that Tylenol was about 10 hours ago before midnight.
Okay, awesome. And then, so we spoke with your OB team and, we got that ultrasound confirmed of your pregnancy. So congratulations.
Thank you.
How far along are you?
I'm 18 weeks.
Okay, and have you had any recent new diagnoses with that pregnancy, like gestational diabetes or hypertension?
Well, I didn't know, none of that, but in the beginning of my pregnancy, I was very nauseous, but that also subsided.
Okay, awesome. And then have you been having any recent complications like vaginal bleeding, decreased fetal movement, or increased contractions?
No.
No? Okay, very good. So we're kind of just going to move into your physical assessment now.
Okay.
So overall, how have you been feeling lately? Have you had any recent colds, fevers, or coughs?
Nope.
No? And then have you ever been diagnosed with anything with your ears, nose, throat, or eyes?
No.
Do you wear glasses or contacts or hearing aids?
I do not.
Okay, and then have you ever had any diagnoses regarding your heart?
Nope.
Do you ever experience any chest pain, palpitations, or feelings of a fast heart rate?
No.
No. Do you ever get short of breath with activity?
I do because of my asthma, but it's usually when I'm doing like vigorous exercise.
Okay, and then does that resolve with your albuterol?
It does.
Okay, perfect. And then, so her MET score is above a 4, and she had an EKG pre-op, and it was good. So I'm just gonna take a quick listen to your lungs and your heart. Take a couple deep breaths for me. And you could breathe normal. Just gonna listen to your heart. Okay, so her lungs sound clear. There's no wheezing or adventitious sounds, and her heart rate is even, and there's no murmurs. I hear S1 and S2. So have you ever been diagnosed with OSA, sleep apnea?
I have not.
No. Have you ever been told that you snore or stop breathing in the middle of the night?
No.
Do you ever wake up extremely tired like you didn't sleep?
No.
No? Okay, and then her BMI is within range and she has no hypertension, so her stop bang is a 0. Have you ever been diagnosed with anything regarding your GI tract, your stomach, your liver, or your kidneys?
You know, just the gestational diabetes with my previous pregnancy, but other than that, nothing else.
Okay, so no other endocrine issues with your thyroid or anything?
No.
And then, besides that right ankle, do you have any other issues with mobility or joint pain?
No.
No? And then, do you ever get numbness, tingling, weakness anywhere?
Nope.
Have you ever been diagnosed with seizures?
Nope.
Have you ever been diagnosed with anxiety, depression, or any other psychiatric disorder?
No.
Have you ever been diagnosed with a clotting disorder or have excessive bleeding or clotting?
No.
No. And then I'm just going to take a quick look at your ankle. So there is some swelling. What would you rate your pain right now?
About a 6 out of 10.
Okay. And have you ever or do you smoke tobacco products, chew, or vape?
No, of course not.
No. And then do you drink alcohol?
No, I do not.
No. And then do you do any illicit drugs like smoke marijuana or do any like pain medications?
No.
No. Okay, so now I'm just gonna do your airway assessment. Can you open your mouth for me, nice and wide? Okay, and then I'm gonna check her mouth opening. And you can close your mouth. So her mouth opening is good, and her Malin-Potty is a 2. And now I'm just gonna check thyromental distance, and that's above 6 centimeters. So that's also within normal limits. Can you move your head up and down and side to side? Do you have any pain with that movement?
No.
So she has good neck mobility. And do you have any caps, broken teeth, chipped teeth, missing teeth, or dentures?
No.
No, so nothing to be removed out of your mouth. Okay, so her airway is very good, so she will not be a difficult airway. And overall, with her medical history and her pregnancy, I'm gonna rate her an ASA 2. Okay, Ms. Ramirez, so you are getting general anesthesia with the popliteal block for pain management.
Okay.
So with general anesthesia, you're gonna have a breathing tube placed in your throat and you'll be completely asleep. You might wake up with a sore throat or nausea, vomiting, but we have some medications that can help with those side effects. Some serious complications that we're not expecting for surgery can include cardiac issues, lung issues, and an allergic reaction to any of the medications we give you. But again, we're not really expecting those serious complications. And then in PACU, we'll be performing your popliteal block for your pain management. Some issues with that can include bleeding or infection. Do you have any questions regarding your anesthesia plan?
I don't think so, no.
No? And then just going over her labs, all her labs were within normal limits. Preoperatively, her coagulation labs were in normal limits for her popliteal block, and her EKG was normal, and her pregnancy was confirmed by ultrasound. So if you have no questions, I'll just have you sign your consent here.
Okay.
Okay, thank you.
Thank you.
See you in a bit.
Okay.